All right, we'll give it a few seconds and then we'll go ahead and get started. All right, I think we can go in as people are starting to come in. All right, so hello everyone, and thanks for joining us today to talk about enhancing your NextGen EHR with IMO Core. My name is Jordan Leibovitz, and I'm part of the marketing team here at IMO. Before we get started, I want to take care of a few items for those attending. All attendees are in listen-only mode, but we'll get you the recording as soon as we can after the webinar. Throughout the session, if you have any questions, type them into your questions section on your GoToWebinar console. We'll have a Q&A session at the end of the presentation, and we'll get to as many questions as we can. But if for any reason your question is not addressed, we will follow up with you after the webinar. So today we have two presenters, Johanna Weiler, the Senior Solutions Engineer, and Josephine Mazza, our Senior Manager of Client Support. So as mentioned before, if you have any questions or comments while our presenters are speaking, please type them into your questions section on your GoToWebinar control panel. And we'd like you to grab a cup of Joe, and I'll pass it over to you, Joe.
Thanks, Jordan. Hi, everyone. So most of you who are joining us today have been partnered with IMO for quite some time and are familiar with IMO's clinical terminology. But to level set with everyone joining us today, and for those who are not yet familiar with the solution we provide for your NextGen EHR, IMO provides clinical terminology to help providers and all end users document with ease and specificity. As of today, 89% of US clinicians use IMO solutions as the clinical terminology foundation in their EHR. We provide over 5 million terms with the appropriate code set mappings that allow you to capture diagnoses and problem records for your patients. In short, we help you document in your own words the way you intend to state the diagnosis, while IMO does the heavy lifting of capturing all the right code sets, such as ICD-10 and SNOMED. We aim to continue improving our clinical terminology each year by building out and providing about 40,000 new terms each year, and also updating the appropriate codes for each term as they evolve with regulatory updates. So we've had a really exciting partnership with NextGen throughout the years as we've delivered our terminology via a template platform that has continued evolving over time. While providing terminology to help you search and capture diagnoses in a more meaningful way, we've also enhanced our solution by providing tools to improve problemless management. We first delivered this combination of clinician-friendly search terms and problemless management tools in our platform called IMO Problem IT Plus. Throughout the past years, we've listened to your feedback on how to make problemless management and clinical documentation more efficient. So today we're going to show you IMO's latest and greatest platform called IMO Core, which now encompasses time savings and efficiencies for both these problemless management tools and the search functionality. To address new opportunities to better use clinical patient data in the workflow, IMO Core is built on the strengths of our legacy tools to help streamline these problemless workflows and also streamline your search experience. Additionally, as NextGen releases upgrades to their EHR, we are continuing to provide the appropriate template changes in the IMO Core platform so that IMO Core is always compatible with your NextGen EHR. I'm now going to kick it off to my colleague Johanna, who is going to provide a live demo of IMO Core.
Hello, everyone. Thank you so much for joining us today. So I'm going to show you a few of the items that Josephine showed us within Core that you have a benefit of. The first one I want to speak to is our enhanced search. So I'm utilizing a template inside of NextGen with my IMO Core button. And as I type, you're going to notice that it's making suggestions. And these suggestions are based on how I have used this template specialty in NextGen, as well as how I function inside of IMO Core. And that's a really big benefit, I feel, for all of our providers and any of our clinical team members, because if you use different specialty templates within NextGen, it's going to remember those differences that you have and help you have these appropriate suggestions based on the frequency of your searches. Once I have selected the suggestion that I would like, or I could continue typing to have a new option, I will see all of my results. These are also done in an efficient and meaningful way. The reason for that is they're in the frequency of the order in which you use them. So for anyone who maybe struggled in the past in finding the diagnosis code that they use the most, that struggle's over, because Core has helped you to identify that through that algorithm that's remembering. I do want to transition to our next topic, but before I do, I have a question for you all. And you should see a polling question pop up on your screen. The question is, are value-based care contracts, or HCCs, pertinent to your organization? And if you will, please use the answers that are available to answer that question. In addition, if this question creates more questions in your mind that you would like to dig deeper into, you are welcome to reach out to your salesperson to ask to discuss this question or other questions further in the future, because we want to make sure that you have all the details that you need for your usage within IMO Core with NextGen. Wonderful. Thank you so much for answering those questions. Let's move over to our HCCs. So inside of Core, what we have done is we have consolidated our HCCs to a singular list. I'd like to remind you that within Problem AT+, we did introduce HCC identification through flags, and those flags were shown not only on the problem list, but also in billing history. However, as Joe said, we did receive feedback that having a consolidated list would be more efficient for all users, and we've done that through this HCC list you see on my screen. In addition to consolidating them to a singular list, we also have identified each of the categories and consolidated the codes into their respective categories. Those categories that are unaddressed will be shown in bright bold red at the top, and as you scroll down, you'll see the collapsed groupings of the categories at the bottom. So that way it's very easy to identify whether you have addressed or unaddressed HCCs for that patient. Within Core, if you would like to address any of these, just like you have with your problem list, you can use the plus sign to bring it in, and it will add it to today's assessment. It will actually refresh your screen, so that way the HCC, when it's added, will bring that in and refresh to make your list smaller. So that brings me to my next question for you all, and we're going to transition to billing history. But before we do, the next poll question I have for you is, does the IMO functionality help with your regulatory needs? So please use the answers that are listed below to answer that poll question that we have for you. In addition, if this sparks any additional questions that you would like to ask or you would like to speak with further, please feel free to reach out to your salesperson to dig into that deeper. You can meet with me or Josephine and your salesperson if you would like to have a demo to discuss any of those areas that could be pertinent to your use with IMO and with NextGen. I really appreciate you all answering those questions. Thank you so much. Let's move to our next area, and that's billing history. Again, I know I'm only focusing on a few of the items inside of Core with NextGen, but I really appreciate you all giving me the time to do so. Billing history was introduced within Problem AT+, and you had the ability to add diagnosis codes via the description or the chronological order, so alphabetical or chronological. But how has this changed for Core? Well, there's a few areas that we have improved with that. And the first is thinking about that regulatory release that you have coming out. Might be weighing on your shoulders a little bit coming October 1st. It's so close. IMO Core is going to keep you up to date. As long as you are utilizing and taking action within Core, you know you will always have the most up-to-date codes within your Core usage. So if you have any provider who is documenting and they want to do a follow-up visit for a patient utilizing an item inside their billing history, when they go to add it in, it could be a single click and it pops right in. But if it is not the code they need at the greatest specificity, because we know when the regulatory codes come out, they could get more specific, IMO will identify that. And you'll see that here in this focus search. The IMO ID is at the top of the focus search, and then it's providing the drill down that your providers are used to get that greatest specificity. So not only are we empowering your providers to have the best coding they need, but we're also enhancing that rev cycle team's benefits, because they have what they need for claims and they don't have to go back to the providers and take time from both of their days to get that specificity. So that's just one of the benefits to the billing history. Let's talk about another benefit we have. And I'm going to turn on my HCC filter. When I do so, you're going to notice a new button. So I could be adding with a single click from my billing history to assessment today, but I really want to highlight the resolve. Because if you have a patient where an HCC is ready to be resolved, you could single click. And when that happens, you get this pop-up that lets you resolve this. So notice I am now at 2 clicks, 1 to select and 2 to proceed. So if that isn't efficient, I don't know what is, because I think 2 clicks could make any provider happy. So I know, again, that I've only shown you 3 of the options that you have in Core, but as Josephine showed us earlier with that list, there are so many more. And if you would like to dig deeper, I encourage you to reach out to your salesperson to do that, or you can follow the outline that Josephine is going to show us in this next presentation. Thank you again.
All right. Thank you, Johanna. So while we strive to deliver quality solutions to our NextGen client base, we also strive to ensure we're providing quality support to all of you whenever you're in need of assistance from IMO. There are 3 channels of communication you can contact us when in need of support. You can email us at customersupport@imohealth.com. You can call us on the phone, or you can use our self-service support portal and become an IMO community member. We are very proud to say that when contacting IMO customer support via any of these 3 methods during our standard business hours, you can expect a response or your case escalated to the appropriate team with the same day that your case is submitted. We just launched this new support portal at the end of 2020, and this is now the place where you can access documentation and other important information from IMO, such as our release dates and the dates that we will be releasing new content to your EHR. This is also the place where you can go and submit your own cases with IMO and communicate directly with various IMO team members right within your case. If you don't already have access to our support portal, please feel free to go ahead and register at the link provided here below, and the customer support team will be able to grant you access right away. And now, Jordan, I think we are going to leave some time for Q&A.
Yeah, thank you both. All right, so we'll be kicking off our live Q&A session. If you have any questions from today's webinar or questions coming into the webinar, enter them now, and Josephine and Johanna will start answering them. Please excuse any brief silence while they review and answer. But we do have one that came in. We are planning a NextGen upgrade in the fall. Do you have to wait until after the upgrade to take IMO Core?
Yeah, I can answer that one. That's a very good question. You do not have to wait until your NextGen upgrade to take IMO Core. IMO Core is compatible with all NextGen versions above 5.8.2, all the way until their latest spring release, the spring 2021 release. So if you wanted to upgrade to IMO Core now, that is perfectly fine. You certainly can, and it will still be compatible with your NextGen upgrade as well.
Okay, and you might have just answered this, but IMO Core is compatible with NextGen spring release, right?
It is, yes. NextGen's latest spring release, IMO Core is compatible.
Okay. Another one came in is, we are a multi-specialty enterprise. Not all of our providers manage HCCs. If we turn on HCC tracking, does that mean it's on for everyone?
So yes, the default of IMO Core is that if you enable HCC tracking, it will be enabled for everyone in the organization. But great news about IMO Core is that it's extremely customizable. So what we can do is customize it so that it is, that HCC tracking list that Johanna was showing is only visible to certain providers and not visible to others.
Great. Okay, I think this one be applicable to Johanna, but I have a provider who uses different specialty templates, example, internal medicine or family practice. Depending on the appointment scenario, will the enhanced search show the same result for each template?
So yeah, absolutely, I can take that. And the answer is no. Core Search is built to look at the specialty and the specific end user search habits. It's tailored to each end user search and selection habits that they are already using. And one of the benefits, again, with Core, as Josephine shared with us, is the history will retain as well. So if you start this year, it will keep remembering through the years your usage. So up to a 10-year remembrance. Very useful.
Oh, awesome. All right, we have a clinical support team that preload chart information for our providers. If the providers are using the IMO Core enhanced search and it finds secondary codes, what happens to the duplicate codes?
So I can take this one. So it's literally impossible to duplicate ICD-10 codes and have them end up in the assessment list. If you're preloading, let's say an N code or a Z code onto your assessment for your provider, and then your provider answers that drill down that would produce that N or Z code, if it is exactly the same, it will not go on there twice. Core is definitely going to make sure your providers do not have that duplication.
Okay. Just a reminder, we're going to answer a few more, but if you have any additional questions, please type them in. If a code is inactivated from the use of ICD code update, will billing history still let providers use my inactive code? That probably is for you, Johanna, right?
I can go ahead and answer that one. One of the Joes. So that's a fantastic question. As long as you're using the billing history in IMO Core, no, there is no possibility that you can take action on an inactive code. What will happen is if there is an inactive code in your billing history list and you see it there and you click on it, IMO is going to automatically update it to the new appropriate ICD code, and that new updated ICD code is what you will see get added to the assessment list. Especially with regulatory coming up, you all may notice in your billing history list, as long as you're using IMO, that functionality start to occur.
Perfect. Are there any firewall or network changes required for IMO Core?
There are not. If you are an IMO user today, your firewall and network changes remain exactly the same as you upgrade to IMO Core. There is no need to make any changes to those settings.
Okay. And then can I have the IMO Core button open to different defaults in different sections of the same template?
Yes. So I didn't show this in mine, but I actually have that in my example as well. So you can have your Core button you can actually have multiple core buttons within the same template, and it can be defaulted to open to different aspects. So for example, in my assessment and plan core button, it defaults to open to search and on the assessment tab. But in my reason for visit section of my template, it opens to search on the problems tab.
Perfect. All right, I think we're on to our last and final question. Do you have any training materials that we can share with our end users?
Yes, we do. So during your transition to IMO Core, we will ensure that you have the training materials such as user guides and training videos. We also offer I'm getting tongue-tied, interactive live trainings with your organization over a remote meeting session so that your end users can ask questions about the changes and also share feedback with us. Because I don't know if you're seeing it, but we appreciate feedback and we use it.
Awesome. Well, I think that brings us to the end of this presentation, and we got out a little early today, so a little extra 10 minutes to your day is always a good thing. But while I still have you, we are hosting a webinar on September 22nd based on that new 2023 ICD-10 code set release. I will send you details in the follow-up email along with the recording of this. So we hope you found today's information useful, and thank you again, Joe and Joe, for this awesome webinar, and I hope you all have a great rest of your day.
Thank you, everyone.
Thank you.